Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Once again, hello, Dr. Moya.
Hello, Brittany.
Hi.
How are you?
Wonderful.
Are you ready for our podcast?
Sure.
Okay, good. Me too.
So let's elaborate a little bit more on consultations, specifically phone consultations. The first thing I want to ask about is who exactly do you offer the phone consultations to?
Great question. You always have great questions,
Thank
Brittany.
you. Thank you so much.
I offer phone consults to patients where traveling just is a little bit more burdensome for them, meaning it's a longer distance. Our cutoff usually is about 2.5 to 3 hour drive. At that point, it may make more sense to do the consult on the phone. And so that's our cutoff. I don't offer phone consults for people who live in the same town or the next town. It's always best to come and see us, and we prefer that. So that's what we use as a guide, basically.
Okay. Is there a fee for these consultations?
Yes. So what we do is we offer two different type of phone consults, meaning two different time frames, which have two different fees.
Okay.
I offer a phone consult during the week, usually at 8 o'clock. Obviously, it's after hours for patients who are very excited about getting on my schedule for surgery. And they want to ASAP. And they want to talk to me, make sure that this is exactly what they want, make sure they're a great candidate. So we offer this phone consult. It's a standard fee for our in-person consultation. It's $95. Then we offer a phone consult for patients who are, hey, I just want more information. Not quite sure if I'm ready yet. Or I can
wait a
while longer. I'm not in a rush. Then we offer it on a Sunday evening. It might even be more convenient for some patients to do it that way because it's Sunday evening. I offer that. I offer two slots. I offer a 7 and 8 o'clock.
PM.
So it makes it more convenient. And we offer that at a reduced rate. It's $58 because it gets booked out.
Right.
That can be booked out for months.
Because it's only one Sunday a month, you said.
Correct. So I usually do it. Yes, I do it one Sunday a month. And now we've narrowed it down to it's the first Sunday of the month, unless it's a holiday weekend, then it's the following Sunday.
Okay. Well, look at you, Mr. Generous, giving up your free time in the weekends and the evenings to help these people.
I love what I do and I want to help people. And so it's okay. Sometimes I'm like, oh, I got a phone consult right now. But then as soon as I start talking to the patient, I get all into it.
Yeah.
I want to help them. I'm like, oh, really? And next thing I know, 2 hours flies by.
Right.
And so it is okay. I don't mind doing that. And I actually enjoy it once I get started doing it.
Yes. Good.
And it seems like we do get, since we're talking about that, we do get a fair amount of patients actually that just from the phone consult, they schedule surgery. So
quite a bit. Yeah.
Quite a bit. Yes. But we'll talk about like what we usually require for that phone consult.
And exactly. So we do send out forms that we need filled out, general information, requesting your driver's license, your insurance card if you have insurance, your health insurance, and then your medical and weight loss history. We like to have those completed fully as much as possible prior to the appointment. And after we get those, we send out instructions on selfies, basically the photo shoot that you need to do at home and send in those photos prior.
Absolutely. And then, for me, if we don't have all the information prior to the call, then I can't do anything. I can't really do the call, so I don't call. I don't call. Yeah. I don't have the information, and then sometimes I don't know whether the patient they signed up, but then they didn't go through with it. So I don't call. Yeah,
it's kind of like a no call, no show in the office. Like they just no showed for the appointment.
That's what my assumption is, and we don't do that lightly. Like we'll send out tons of reminders,
right?
we need this, we need that. And we get it. Maybe for sometimes, maybe in some
Something comes
instances,
up.
patients, something comes up or they just decided they don't want to do it or whatnot. So, but we always give them to the last minute.
Literally, yeah.
Basically, on a Sunday, I don't have any staff available on a Sunday. I'm checking online, seeing if the forms came in. I will give it to exactly the time of their appointment to get all this stuff in.
Right.
So just get it on in there,
Yeah.
and you'll get a call from Dr. Moya at that time slot.
So these patients do have plenty of time ahead to get this information submitted and prepared.
That's correct.
Photos that we ask for. Let's talk about the quality of photos that we need to have for that. Can you?
The quality of photo should be where I can actually see what's going on. Meaning, if there's a rash there let's say we're looking at something with the overhang of the lower apron, and we're considering insurance, I actually have to be able to see enough that there's redness or a rash there. So that's the clarity of the picture that I need. If we're looking at a general picture from far away, let's say, the whole body, you're just looking, as long as I can make out the skin, the rolls, then we're good. Definitely can't be something really small that I try to zoom in on, and you can't zoom in, it's too blurry. So I would say most phones today, smartphones today, they all take good quality pictures for at least for these selfies. You don't need to have a camera,
Right.
A special camera like a Nikon or, an Olympus camera. You can just use your phone as long as it's a good quality and a picture that I can zoom in on it. That's really the key.
Probably better to have all of your clothing off, including bra and underwear, because they can interfere with what's actually, the skin rolls.
That's actually a good topic, is talking about how do you do those selfies. It is much easier for me to come up with a game plan if all the clothes are off, so I don't have an area that's being pinched tight by a piece of clothing, and I don't know
how the skin is naturally falling.
Correct. I don't know how it's going to affect what I'm deciding would be the best treatment plan.
Right.
So definitely clothes off is the best. I know that's a kind of embarrassing for, and we really appreciate patients doing that. I think I would be embarrassed to do that, honestly, but I need that to make the right decision for them. It has to be no clothes on at all. And then it has to be good enough lighting.
Right.
With a background, best if you don't do it in front of a TV or a fireplace. It'd be best to pick a wall in your house that doesn't have much on it. And take pictures there with a light, obviously with some good lighting that I can see.
Helpful if somebody else is able to take the photos for them. I've seen some come through. They're trying to do selfies in the bathroom mirror, which is sometimes difficult to see as well. I mean,
yes, I totally agree. Obviously helpful if somebody takes the photographs for the patient. I know that's even more embarrassing. Yeah. So if they were going to not do that, then they got to get the right setup with a tripod, one of those little tripods for your phone or something, and you can put it on a timer. Just, you can look at it before you take it, hit the 10-second timer, then go and stand there. I don't mind those kind of pictures too. Maybe it's not exactly perfect, but it's enough that I can see things. And that's why it's important to send those early.
Right.
Because if they're not the best and you don't want somebody to take them, we can keep telling you, hey, can you reshoot them? Can you redo this? Dr. Moya can't see this part. So sometimes patients wait till the last minute, but really it's better if you're going to do your own selfies, just get them in earlier. And then we'll look at them, screen them, and tell you, hey, these will be good, or hey, can you do a couple more before the phone consult?
There have been a handful of photos that I have seen in advance that I've noticed it was a little difficult to tell the exact mobility of their skin. So it looked a little fuller maybe. So I requested they send a video of them kind of pulling this, squeezing this, tucking this and shaking around. Maybe it sounds funny and weird and awkward, but it's much easier to tell that on a video versus them just standing straight in a picture.
Absolutely. And that's very helpful to me. And again, making a plan for surgery is the mobility of the skin. So the videos are very helpful. So, and you're all over that when you notice it, if you can get the pictures in early.
Yeah.
Sometimes I actually have to tell patients to set, I'm talking on the phone to do it, and it slows down the phone call, you see.
Right.
But we have to get what we have to get to make the right decision.
Right.
So,
and we do this because phone calls are a little bit easier than doing a video call and trying to evaluate via like a Zoom or something along those lines, because the quality and
it's terrible. Actually, it breaks up, it stops halfway, and I've tried that multiple times, and each time I regretted it. We actually disconnected and went back to the phone,
right,
and had them send the pictures.
Yeah, so it's just easier to kind of evaluate photos a little bit longer than just quickly on a video call.
And once we get the right photos, I've been doing this long enough that I'm 100% sure that the plan is going to work. I've not had a patient where we do the photos and then they come from their out of town with their planned surgery date, and all of a sudden we're like, oh my goodness, we can't do this surgery. No, that hasn't happened. If we just don't have the right pictures, we're going to ask for certain things. If really I'm having a difficult time that I really can't tell, then I would mention to the patient, if you really wanted to do this, then you might need to come in person for a consultation.
And we've had just a couple of those.
Very few, but we do the right thing. We're not going to just take a shot and say, oh, I'm sure that we can do that. And then the patient comes from California, and then we're like, this is not going to work.
Right.
So we'll always do the right thing.
Right. Perfect. And then, like you said previously, you send out a quote to them within the next day or two, and then they are welcome to schedule surgery if they'd like to proceed.
Absolutely. It's just the same way we would end an in-person consult, get them the financial information so they can put that together with everything that we talked about to decide that if this is the right thing for them, and go to the next step.
Perfect. Okay. That's a lot of fabulous information.
It was a very good podcast.
Okay. Thank you.
All right. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.